All right, so heart disease is one of the most common health problems that affects people in the United States. Very common, and chances are you probably have known or will know somebody that has some sort of heart disease, whether it's high blood pressure, high cholesterol, a heart attack, blocked arteries. It's very common. So we're going to talk a little bit about that to begin here today. And one of the first things you have to know is the heart itself. Like, what kind of tissue is it made out of? The heart's a what? Muscle. Yeah, it's a muscle, basically. And like any muscle in your body, like your biceps or your quadricep or something, in order for it to work, it needs oxygen, it needs energy, okay? It generates waste, which needs to be taken away. So the heart, even though it's filled up with blood, it needs a blood supply as well. And its blood supply comes through what we call these coronary arteries. These are the arteries that give the heart its nutrients, its oxygen that it needs. So the coronary arteries, if you look at the model of the heart, they're all surrounding the outside of the heart. This model shows the coronary arteries. The heart's gone, but you can see this network of blood vessels, of arteries. That's what would be supplying the heart muscle itself with oxygen, with nutrients and so forth. So these are very, very important. If there's damage to these coronary arteries, if they become blocked, well, then blood can't get to the heart muscle itself, and what do you think happens to it?
You die.
It could stop working. You don't necessarily die immediately, but as those clog up, the heart is sort of starved for oxygen. It doesn't work as well. It can eventually stop working. Okay? Not a stroke, but a heart attack.
So it's just like shuts
Yeah, it can't work because it doesn't have enough oxygen. Just like your muscles and the other parts of your body, they can't work if they don't have a constant supply of oxygen. So what are some things that can happen to arteries that's a problem? So what kind of things might happen, Gavin?
Don't like arteries like close up?
Yeah, they can get sort of clogged up, okay, with different materials. They're called plaques, fatty substances, which can build up on the insides of the arteries, such as you see down here. This is a normal artery, nice and smooth on the inside.
Can they clot?
Yeah, clots can lodge in there. And this is an artery that has plaque built up, this substance. And so as the artery becomes narrower for blood to flow through, it thickens, it becomes less flexible, and doesn't work as well. Blood can't get through as quickly or as easily. Okay? And so those blockages can be dangerous. Okay? It can result in a person having chest pain. You know, as it starts to get blocked, one of the symptoms they might have is they get chest pain. Okay, caused by this narrowing of the arteries, can eventually, if left unchecked, lead to a heart attack. So what is this stuff? What is cholesterol? I know you've heard it before. What exactly is it? Tatum? It's a fatty substance. So we ingest cholesterol when we eat any animal products. Cholesterol is found in animal products, meat, cheese, dairy products, eggs. But also our body makes cholesterol internally as well. You know, some people have higher cholesterol levels, not because they eat a poor diet, but because their body just, for some reason, makes more of that cholesterol. There used to be a teacher when I first started teaching here, and every day for lunch, he would just eat a couple of saltine crackers and a piece of fruit and had a very good diet, but still had very, very high cholesterol. Okay? It wasn't because he was eating a lot of cholesterol, it was because his body was manufacturing it. So if there are these, you don't have a couple of these slides, if there are these clogs where this plaque has built up, like you see here, there's a couple different types of treatment that a doctor might do. And one of those things is something called angioplasty. Angioplasty is pretty interesting. What they do is they take a very, very thin wire that they can kind of steer, the doctor can steer it, and they insert it into an artery. Usually they do it into an artery in the groin, right around in the hip area. We have two major arteries which go down each of our legs, and they can actually insert this very fine wire into this artery, and they start to steer it and move it up into a person's torso, all the way up into their chest. They can steer this wire around their aorta, and they can guide it into different arteries of your body. And what they can do, first of all, is they can inject a dye that they then image, and they can see all of your arteries and see if there's any clogs. They can see where blood is not flowing. And that can tell them if there's a blockage. The other thing that they can do is they can insert at the end of this wire something called a balloon. It's a narrow, sort of long, thin balloon that they can inflate with air. What they do, I'll show you, I think there's a better picture here, is they guide it to the blockage where that plaque has built up, and then they inflate the balloon. And that balloon sort of squeezes the plaques to the side and opens up this artery more than it was before. That's one thing they can do.
Doesn't it stop them from having another heart attack or something?
It can temporarily. So
you get like a new heart.
balloon angioplasty, which is what this is called, is kind of like a temporary fix. You can sort of smush aside the fatty buildup, open the artery up, but chances are it might start to close up again. So another treatment is called inserting a stent. Has anyone ever heard of that? A stent is basically the same kind of procedure. They find the blockage, they guide the wire there, they have a balloon attached that they inflate, but around that balloon, they put this little mesh, a metal treated mesh, that they expand, and then it kind of locks in place, and then they take the wire out and the balloon out. And the wire actually stays inside of a person's artery.
Forever?
The wire, yeah, forever. The wire has special chemicals on it that prevent fatty buildups from sticking to it. So it kind of keeps that area open for a longer period of time and prevents it from closing back up again. So if you've ever heard of somebody you know, maybe a grandparent or an uncle or an aunt or a parent even, getting a stent put in, that's what's happening. They're putting a little reinforcing wire mesh into an area that's being blocked.
Can the person like feel the when they
Once it's in there?
feel it?
You mean once it's in there and they take the wire out and everything? No. But I mean, they might feel when they're moving the wire around, they can usually feel that. I don't believe they're usually unconscious for that.
How do they get it in?
What's that?
How do they get it in?
With that wire that they put in all the way. So they put the wire in and the stent is collapsed on there, and they guide it to the artery, to the blockage, and then they inflate the balloon. That opens the stent.
They stab it in your leg.
Yeah, they put it into the artery of your leg. And again, here's just sort of another view. Here there's a blockage here. You can see where the artery is narrowed. They put the stent in with the balloon, expand it, and then it stays in your body. Now, that would be if you have a blockage in a coronary artery that's building up and blood's not flowing through. Probably one of the things they would try is the stent. Sometimes the stent doesn't work, that it's not able to keep it open or the blockage is too big. And then they may have to do a more extreme procedure. Does anyone know anyone that's had bypass surgery? Okay, so bypass surgery is, again, it's a way of trying to relieve and restore the flow of blood to the heart. So here again, we see a heart. What we see is there's a blockage here and here. And so blood coming out of the aorta can get down to this part of the heart, but because of this blockage, enough blood can't get down here. And so that part of the heart is kind of starved for blood. It's not going to work well. On this side, again, a blockage here means blood can go here, but it can't get down to the lower parts of the heart. So this person might need bypass surgery. In bypass surgery, what they do is they could do it a couple ways. They could take this vein out of your leg, cut a little section of it out of your leg, bring it up into your heart, and that's what they've done here. And they sew it, they stitch it to your aorta right here, and then they bring it down and stitch it to this coronary artery down here. So now, even though there's a blockage here, blood can go up through your aorta, and some of it will come down through this new vein that they added in to nourish these other parts of the heart. So it's basically cutting a piece of the vein out, pasting it back in so blood can go. That's what bypass means. It's bypassing the blockage. Blood's going around the blockage. Another way they can do it is through using a mammary artery. An artery we already have branching off of our arteries here that would connect into our chest, but instead they cut it out and it no longer connects to the chest, and they attach it here to this coronary artery. So now as the blood flows through the aorta, through this artery, some of it comes down through this mammary artery, which now has been placed here, and so again, blood goes past the blockage and can nourish the heart. And so that's what bypass surgery is. You know, you may have heard somebody has single bypass surgery, or double bypass, or quadruple bypass. What that means is how many blockages they had to go around. Somebody had a question. Haley?
How do you like stitch the thing?
Using really, really small tools.
Do they have to like take it out?
Yeah, so good question. So how do they do surgery on your heart if you need your heart to live? They put a person under anesthesia. What they do is they hook you up to what's called a heart and lung machine. A heart and a lung machine sort of acts for a little while as your heart and lungs. It has a pump which continues blood moving through your body. It has a machine that puts oxygen into your blood and removes carbon dioxide, like your lungs. And that machine sort of takes over for your heart, and they stop your heart, hook you up to the heart and lung machine, and they do the surgery. Now, obviously, how are they going to get at your heart to do this surgery? Yeah, it's major surgery. They have to, in traditional open heart surgery, they have to cut through the skin in your chest, and they have to cut through the pectoral muscles underneath. And then what's after that? No, your sternum, right? That thick protective bone. So they then have to saw through your sternum, and then they use this tool called a rib spreader. This is a rib spreader. These two prongs, once they've cut through your sternum, they put these two prongs into it, and then they crank this, and it starts to open up, and it spreads apart your sternum into two pieces so that they can start to do the surgery at your heart that's just underneath your sternum. Here's a drawing of what it would look like. So again, the arms of the rib spreader open up so they can access the heart here. The next one is a real picture, so if you don't like that stuff, don't look for a minute. So this is open heart surgery. What you have, you see here is the rib spreader. You can see the metal of it. It's in here holding open this area where the heart is. You can see there's tubes here bringing this person's blood to the heart and lung machine so that they can then do this operation on that person. Kendall?
So like after the surgery is done, does it, how do they have to like this? They have to like be in like a cast or like
Not quite a cast. So this is a major surgery where you're sort of out of commission for a long time, weeks, because once they're done with the surgery, they remove the rib spreader so your sternum can come back together. They probably use some sort of stapling device to hold the piece of the sternum together while the bone reheals. They have to stitch up any muscles that they had to cut through. They have to stitch back your skin. And obviously it takes a long time for that to heal. Now, people that need this type of surgery generally are not in the best health, right? Because they had heart problems. And so it's a major surgery. And it has a lot of risks that go along with it. You have to be under anesthesia for a long time. They have to cut you wide open. You have to be hooked up to the heart and lung machine. So it has definite risks as well. Tatum?
It's like a healthy person needing heart surgery.
Not, well, I mean, there's lots of types of heart surgery. We're just talking about bypass surgery.
Could like a healthy person have that?
Not usually, but there could be instances when they have a blockage, even if they're healthy. It's much less common though. Usually a person that has had maybe a poor diet, okay, maybe severely overweight, may not ever exercise and may eat foods too high in cholesterol and not take care of their cholesterol. So, you know, those are all kind of risk factors.
Wait,
Yeah.
so how would someone like, I know sometimes they switch out hearts. How could they possibly do that?
Yeah, they can transplant a heart. So a person with severe heart disease and their heart is not working properly can get a heart transplant. And basically, similar sort of thing, open up your chest cavity like that, but they need to have a heart from a person who has donated their organs. So if a person is an organ donor, when they die, they've given doctors permission to take any of their organs that might be helpful to another person. Kidneys, eyes, heart, lungs, all sorts of tissue can be donated to a person in need. And so they have like, you know, a short window of, you know, 24 hours when they have to take that heart out of the person that just passed away, pack it quickly in ice and materials, get it to a hospital where a person's waiting for the transplant, and then they basically just sew in, connect all those arteries back together, and a person gets a heart
What
transplant.
happens if like you're like sick or something and pass away from like a disease, but they use like your body?
Well, like if you died of heart disease, they wouldn't use your heart. They would take any healthy organs. There's artificial hearts, mechanical hearts that they could temporarily use. They generally don't give that to a person permanently, but they could keep a person alive if their heart is completely not working until they can get an actual transplant. Gavin?
Like, you know how like when you die, like your heart stops.
Mm-hmm.
How would that work?
Because the heart stops, so it doesn't have any blood anymore. But if they quickly remove it and put it on ice, it doesn't decay and break down for a while. Okay? And it stays preserved for a period of time. And it's still healthy enough that they can put it into another person. All right, now, so that's open heart surgery. But there's new methods of surgery that are much less what we call evasive, much easier to recover from. This is a DaVinci Robot.
Do they use these?
Yeah. This is called robotic assisted surgery. So it's not like there's like the droid from Star Wars doing the surgery when it was reconnecting Luke's hand, but a doctor controls the arms of this robot. So the patient would be laying in this on this operating table. This is the robot. It has 3 arms that move, and the tools are these long, pointy tools. And the doctor controls these tubes here at the control station. This doctor's looking in. He gets a 3-dimensional view of a camera attached to one of these arms. And his arms and hands and his feet operate the other arms and move them around in different ways. And they allow this doctor very, very precise control over those instruments. They brought one of these robots as like a demonstration to the high school about 4 or 5 years ago. And Mr. Artery and I went and saw it, and we can use it. Not to do surgery, obviously, but they had a little demonstration up where you can pick things up and you can use the tools. It's really neat how it works. Like, you basically have your fingers clipped in, velcroed into this thing, and when you rotate your wrist, the tool on the robot rotates, and you close your fingers, the little pincher on the robot closes. It's really neat how this works. And so in this type of surgery, they don't cut you wide open. Those pointy tools poke into your body, you know, through your ribs. The biggest one goes in through your belly button, okay? And they can go under your ribs. And so they don't cut you wide open, so it's much easier to heal from this type of surgery than it is to heal from traditional open heart surgery. And it's not just used for hearts. My father, he had prostate cancer. He had to have a part of his prostate gland removed. And so he went to Rochester and had that surgery, and they used this robot, the DaVinci Robot, to do that surgery. It depends. For certain things, not every hospital has these types of robots. And there's other brands. Like you might hear like a radio advertisement. You ever hear the Mako robots, a different type? They have lots of different types of these. And they're becoming more and more popular because, again, they make the recovery from surgery much quicker than traditional surgery. And they give the doctor very precise control. This video shows a surgeon using the DaVinci Robot to fold a teeny tiny little paper crane. What was your question, Gavin? I'll show you in a minute.
Like how did they come up with the name?
Da Vinci?
Yeah.
Named after Leonardo da Vinci. I don't know why they picked that. So these are the tools. You know, these are tiny little pinchers. They have different tools they can add to those, like some tools for cutting or suturing or grasping. They can attach different tools. And you can see there's basically folding up this little thing. This is smaller than a dime. You'll see a dime in a minute. But see how well he can manipulate or she can manipulate these things using this robot. They can work a much finer even than a human hand can. And it fast forwards here in a minute so you can. And there you got your little paper cranes. So look, this one that's a tiny little, I mean, just a few millimeters wide. So they give the doctor very, very precise control. I won't show you that one. That's a paper airplane. All right. Our last topic we need to cover, that's going to be on your quiz, is about blood types. Does anybody know your blood type? I don't know mine. Kendall, you know yours? What is it?
Mine's like O positive.
O positive. Anyone else know theirs? Next time you go to the doctor, you can just ask them. It's in your chart. Why is that? Why is your blood type important? Is that?
In case you need a donation of blood.
Yes. Sometimes people may lose a significant quantity of blood in an accident or an illness, and they may need a blood, what we call a transfusion, where they take blood someone else has donated and put it into your body. One of the girls who plays on my soccer team, she goes to Holland Patton, and at her school today they're having a blood drive. She told me to practice. And so they have these blood drives. You know the organization that runs them?
Red.
Yeah, the Red Cross. And you go and you can donate blood. They put a little needle in a vein in your, in the sort of crook of your elbow, and they take out, you know, maybe a pint of blood or so. Okay? And they take that, they screen it to make sure there's no diseases or anything. They figure out what type of blood you have, and then they store it away. And when somebody needs that blood, they can get that to help save their life. So blood type is, there's 4 blood types. Okay? And they're named based on these proteins they have called antigens that are attached to the outside of the red blood cells. Antigens are these little proteins on our cells, and they're kind of like little flags advertising that, hey, I'm one of you. I'm part of your body. To your immune system, don't attack me. Okay? And so there's 2 antigens that might be on your red blood cells. Type A antigens and type B antigens. And that's what your blood type's named after. Now, they don't actually look like this, but this can help you understand it. A antigens are being shown here as these little circular things. Okay? They're not nearly this big. They'd be microscopic. B antigens are shown as these sort of spiky things. So if a person has the A antigens, what type of blood do you think they have? Type A blood. If they have the B antigens, type B blood. But some people on their red blood cells have both, a combination. What type of blood do they have? AB, it's called. AB. Don't include that and sign, please. And a person might have neither one. What do we call those people? Type O blood, if they don't have either the A or B antigen. So that's what so yeah, Kendall, if you're type O blood, you don't have either the A or B antigens on your blood cells. Now, this becomes important because floating around in our plasma, we have something called antibodies. Antibodies are proteins that help defend our body against foreign cells that should not be there. Things like bacteria, viruses, things like that. But if antibodies against the A antigens combine in your body, they can destroy your own blood cells. That's not good. It's called hemolysis. It could cause you to die, actually. if your own antibodies attack your own antigens on your red blood cells. But luckily, that doesn't happen. Because a person with type A blood, what type of antigens do they have on their red blood cells? A antigens. Do you think they have antibodies against A in their plasma? No, that would make no sense. Their antibodies would attack those and they would die. They don't have those, but they do have one type of antibody.
C. O.
They have B antibodies. Is that okay? Yeah, because they don't have any B antigens, so these B antibodies are fine. Person with type B blood, what type of antigens are on their red blood cell? B. What type of antibodies are floating around in their plasma? A. Are they okay? Yes. A person with type AB blood, which antigens are on their red blood cells? A and B. So, what do you think about this? Well, I heard somebody say it. No? None. So they don't have antibodies against A or B. If they did have A antibodies, what would happen? They'd attack their cells. If they had B antibodies, it would attack their red blood cells. They don't have either antibody. So are they okay? Yeah. No, well, they have other antibodies against other things, but not against A and B.
So pretty much they cancel each other out. You just don't want to duplicate one.
Right. So type O blood, which antigens are on the red blood cells? There is no O.
None.
None. They don't have either. What do you think antibodies they have? A and B. Are they okay? Yeah. Because there's nothing to attack on the red blood cells, so they're okay also. So every blood type is okay, but when does it become an issue? Yes, if somebody else's blood is put into your body. When they do give somebody a blood transfusion, we call it, they only put the red blood cells into that person.
So like how you spun it and like just
Yes. So, we know if we mix antigens and antibodies that are the same, bad. Hemolysis happens, blood cells die. All right, so type O blood. What type of antigens are on the blood cell? Neither one. So who can get that put into them? Anybody. Type O is called the universal donor because anybody can receive type O blood. It doesn't have any of those antigens on it, so it doesn't matter. If a person gets rushed to the emergency room, they need a sudden transfusion of blood, and they don't know their blood type, what do they give them? Type O blood first, until they find out their actual blood type.
Yeah, I have a question.
Hold on, let me just finish this section and then I'll answer. Type AB blood. Which antibodies are in the plasma of a person with AB blood? Neither.
They give
Who can they receive blood from? Anybody, right? Because they don't have any antibodies to attack the A's and B's. They're called the universal recipient. They can receive it from anybody and be fine.
So they can get
But you can't give it to somebody?
You can only, yes. So if we summarize this whole thing, a person with type A blood has type A antigens on their red blood cells, have type B antibodies in their plasma. Who can they get a transfusion from? Another type A person or a type O person.
Wait, but wouldn't that they attack
Couldn't they all just get one from
antigens?
What's that, Gabby?
Wouldn't that
A person with type B blood. They can get blood from another type B person or O. AB can get blood from,
AB or O?
AB, O.
they have none of these antibodies, so they can get it from
AB,
anybody. Because they have none of these antibodies in their plasma, so they can get it from anybody. And a person with type O blood has A and B antibodies.
Oh, no.
Only O. You can only get it from type O person.
What's positive and negative?
We'll talk about that. Oh, so positive and negative. So first off, a lot of people ask, we have one more little section to do here. So people, yeah, you don't have this, but there's one more slide. So people always ask what's more common. In the United States, and this varies around the world. In the United States, type O is the most common, then type A. Type B is pretty rare, and type AB is the rarest of blood flows. That positive, negative part you heard? Okay, oh, here you go. So this is in the United States. We'll talk about the positive and negative in a minute. So again, only 4% of people are AB. So that RH thing, so that plus or minus is something called RH factor. It's basically another antigen, besides the A and B antigen, that some people have on their blood cells. Most people have the RH antigen on their red blood cells, about 85% of people. And that's fine. It becomes an issue, though, sometimes in pregnant women. If a woman is pregnant with RH negative blood and her fetus has RH positive blood, it can be a problem. And they have to get certain types of medical treatment to make sure the fetus and the mother are okay. Yes.